Chapter 49, Diabetes Mellitus, Nutrition. The review from class and the Lewis textbook. Meal planning should be based on the individual's usual food intake and preferences and balanced with insulin and exercise patterns. Patients using rapid-acting insulin can make adjustments in dosages before the meal on the basis of the current blood glucose level and the carbohydrate content of the meal. Intensified insulin therapy, like multiple daily injections or use of an insulin pump, that allows considerable flexibility in food selection and can be adjusted for alterations from usual eating and exercise habits. The emphasis for nutritional therapy in type 2 diabetes should be placed on achieving glucose, lipid, and blood pressure goals. Modest weight loss has been associated with improved insulin resistance, so weight loss is recommended for all individuals with diabetes who are overweight or obese. There is no one proven strategy or method that can be uniformly recommended. A nutritionally adequate meal plan with appropriate serving sizes and reduction of saturated and trans fats and low carbohydrates can bring about decreased calorie consumption. Spacing meals is another strategy that spreads nutrient intake throughout the day. A weight loss of 5 to 7% of body weight often improves glycemic control, even if desirable body weight is not achieved. Weight loss is best attempted by a moderate decrease in calories and an increase in caloric expenditure. Regular exercise and learning new behaviors and attitudes can help facilitate a long-term lifestyle change. Monitoring of blood glucose levels, hemoglobin A1C, lipids, and blood pressure provide feedback on how well the goals of nutritional therapy are being met. Carbohydrates include sugar, starches, and fiber, and provide important sources of energy, vitamins, and minerals, and are important to all people, as well as those with diabetes. The recommended daily allowance for carbohydrates is a minimum of 130 grams a day. Foods containing carbohydrates from fruits, vegetables, whole grains, and low-fat milk should be included as part of a healthy meal plan. Glycemic index may provide additional benefit. Sucrose-containing foods can be substituted for other carbohydrates in the meal plan, and fiber intake should be 25 to 30 grams a day. There is no evidence that a person with diabetes should consume more fiber than an individual who does not have diabetes. The current recommendation for the general population is 25 to 30 grams a day. Nutritive and non-nutritive sweeteners may be included in a healthy meal plan in moderation. Non-nutritive sweeteners include the sugar substitutes saccharin, aspartame, sucralose, neotam, and acesulfame potassium. Glycemic index is the term used to describe the rise in blood glucose levels after a person has consumed a carbohydrate-containing food. The glycemic index of foods was developed to compare the postprandial responses of carbohydrate-containing foods. Foods with a high glycemic index raise glucose levels faster and higher than foods with a low glycemic index. The use of glycemic index may provide a modest additional benefit over that found when total carbohydrates are considered alone. Dietary fat provides energy, carries fat-soluble vitamins, and provides essential fatty acids. The ADA recommends limiting saturated fat to less than 7% of total calories. Less than 200 milligrams a day of cholesterol and limited trans fats are also recommended as part of a healthy meal plan. Decreasing fat and cholesterol intake assists in reducing the risk for cardiovascular disease, and 2 or more servings of fish per week provide polyunsaturated fatty acids. The amount of daily protein in the diet for people with diabetes and normal renal function is the same as for the general population. That would be 15 to 20% of total calories, and high-protein diets are not recommended for weight loss. Alcohol inhibits gluconeogenesis, which is a breakdown of glycogen to glucose by the liver. This can cause severe hypoglycemia in patients taking insulin or oral hypoglycemic medications that increase insulin secretion. Encourage patients to discuss their use of alcohol with their healthcare provider because its use can make blood glucose more difficult to control. Moderate alcohol consumption can sometimes be safely incorporated into a meal plan if blood glucose levels are well controlled and if the patient is not taking medications that would cause adverse effects. Moderate consumption is defined as 1 drink per day for women and 2 drinks per day for men. A patient can reduce the risk for alcohol-induced hypoglycemia by eating carbohydrates when drinking alcohol. To decrease the carbohydrate content, it is recommended to use sugar-free mixes and drinking dry, light wines. Guidelines from the American Diabetes Association's indicate that within the context of overall healthy eating, a person with diabetes can eat the same foods as a person who does not have diabetes. This means that the same principle of good nutrition applied to the general population also applies to a person with diabetes. The goal is to maintain blood glucose levels to near normal. This will help prevent or reduce the risk of complications of diabetes. Achieve lipid profiles and blood pressure levels that also reduce the risk for cardiovascular disease. To prevent and slow the rate of development of chronic complications of diabetes by modifying the nutrient intake and lifestyle. Address the individual nutritional needs while taking into account personal and cultural preferences and respect the individual's willingness to change. And maintain the pleasure of eating by allowing as many food choices as appropriate. The nutrient balance of a diabetic diet is essential to maintain blood glucose levels. Nutritional energy intake should be balanced with the energy output of the patient, taking into account exercise and metabolic body work. Each patient's individual meal plan should be constructed with their lifestyle and health goals in mind. Most often, a dietitian initially teaches the principles of nutritional therapy. Whenever possible, the nurse should work with the dietitian as part of the interdisciplinary diabetes care team. In some instances, access to a dietitian is not possible for patients because of limited insurance coverage or for those who live in remote areas. In these cases, the nurse would have to assume responsibility for teaching basic dietary management to patients with diabetes. Diabetes exchange lists are another tool for meal planning. Instead of counting carbohydrates, the individual is given a meal plan with specific numbers of helpings from a list of exchanges for each meal and snack. The exchanges are starches, fruits, milk, meat, sweets, fats, and free foods. The patient will choose foods from the various exchanges on the basis of the prescribed meal plan. For some patients, this method may be easier than carbohydrate counting. The other advantage of this approach is that it helps the patient limit portion size and overall food intake, an important component of weight management. For a diabetic person, each meal has 1/2 of the plate filled with non-starchy vegetables, 1/4 is filled with the starch, and 1/4 is filled with the protein. A glass of non-fat milk and a small piece of fresh fruit would complete the meal. It's important to include family members and caregivers in nutrition education and counseling whenever possible, particularly talk to the person who cooks for the household. Independence should be fostered, except in special situations in which there is a barrier to self-care, such as visual or cognitive impairment. It's also important to discuss traditional foods with the patient. To improve adherence, the diet needs to be individualized to take into account the patient's preferences and foods that are culturally appropriate. Any new exercise program for diabetic patients should be started only after a medical clearance. Patients should start slowly with gradual progression toward the desired goal. Patients who use insulin, sulfonylureas, or meglitini are at increased risk for hypoglycemia when there is an increase in physical activity, especially if the patient exercises at the time of peak drug action or if food intake has not been sufficient to maintain adequate blood glucose levels. This can also occur if a normally sedentary patient with diabetes has an unusually active day. The glucose-lowering effects of exercise can last up to 48 hours after the activity. It's recommended that patients who use medications that can cause hypoglycemia schedule exercise about 1 hour after a meal, or that they have 10 to 15 grams of a carbohydrate snack and check their blood glucose level before exercising. Small carbohydrate snacks can be taken every 30 minutes during exercise to prevent hypoglycemia. Patients using medications that place them at risk for hypoglycemia should always carry a fast-acting source of carbohydrate, such as glucose tablets or hard candies when exercising. Although exercise is generally beneficial to glucose levels, strenuous activity can be perceived by the body as a stress, which then would cause a release of counter-regulatory hormones that result in a temporary elevation of blood glucose. In a person with type 1 diabetes who is hyperglycemic and ketonic, exercise can worsen the hyperglycemia and ketosis. So vigorous activity should be avoided if the blood glucose levels exceeds 250 milligrams and if ketones are present in the urine. If hyperglycemia is present without ketosis, it is not necessary to postpone exercise. The American Diabetic Association recommends that people with diabetes perform at least 150 minutes per week. That's 30 minutes, 5 days a week, of moderate intensity aerobic physical activity. They also encourage people with type 2 diabetes to perform resistance training 3 times a week in the absence of contraindications. Exercise decreases insulin resistance and can have a direct effect on lowering blood glucose levels. Plus, it also contributes to weight loss, which decreases insulin resistance. The therapeutic benefits of regular physical activity may result in a decreased need for diabetes medication in order to reach that target blood glucose goal. Regular exercise may also help reduce triglycerides and LDL cholesterol levels, increase HDL levels, reduce blood pressure, and improve circulation.